Today, I rise in defense of Michigan seniors and working families and to speak on the nomination of Representative Tom Price to be Secretary of Health and Human Services. It is my duty as a member of this body to only support a nominee for this position if I trust that he or she will put the health and wellness of American families first. Representative Price has failed to convince me that he will do this. As a doctor, he should be familiar with the Hippocratic Oath. Reciting this oath is a rite of passage for physicians in our nation and across the globe. While it is known most widely for its overarching message of do no harm, I would like to recite a passage from the modern version of the Hippocratic Oath that should resonate with all of us. It reads, and I quote, "I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes those related problems if I'm to care adequately for the sick." End of quote. We should all heed these words. Healthcare is deeply personal. Some of the most important decisions Americans will ever make will be with the advice of their loved ones and their doctor. Healthcare affects our families and the economic stability of our families. Quality, affordable healthcare can literally be the difference between life and death. A Medicare system that works for seniors can be the difference between a retirement with dignity and having to spend their golden years in poverty. Madam President, when it comes to our nation's seniors, Congressman Price has crafted extremely dangerous proposals that would end Medicare as we know it. He has introduced legislation that would turn Medicare into a voucher system, increase the eligibility age for seniors to enroll the program, and lead to increased drug cost. Our nation's seniors have worked hard for their entire lives, and they deserve a dignified retirement, not higher drug cost or a voucher that could be worth less each and every year, putting a significant strain on their fixed budget. We must honor our promises to current and future retirees by refusing to confirm any HHS nominee who is not fully committed to protecting our seniors and ensuring that they have the health care that they need. We need a secretary who wakes up every morning thinking about how to provide the best care possible to as many Americans as possible and as affordably as possible. I'm concerned that Representative Price sees our healthcare system as a profit center for special interest and a profit center for himself. He has proposed dangerous plans to end critical investments that make our healthcare system better so that he can give large tax breaks to some of his wealthy friends. The American people should be confident that the men and women leading federal agencies are thinking about the bottom line of taxpayers and not themselves. We must be faithful stewards of taxpayer dollars. Madam President, I'd like to remind my colleagues that Medicare and Medicaid spend far less on overhead and operations than private insurance. I would also like to remind my colleagues that the Republican budget plan that includes repealing the Affordable Care Act would increase our national debt by upwards of $9 trillion over the next decade. Yes, that's trillion with a T. We must continue efforts to cut waste and inefficiencies across the federal government, especially in healthcare. Increasing efficiencies allows us to invest in what works. Medicare and Social Security are two of the most popular federal programs ever created, and they are popular for a reason. They work. They work for seniors. They work for the disabled. They work for orphans, and we should too. When I hear from Representative Price that he wants to fundamentally change Medicare and Medicaid and implement health reforms that will limit care for American families, this is something that I cannot and will never support. Representative Price has introduced proposals to cut over $1 trillion from Medicaid, that will jeopardize care for millions of low-income working Americans, senior citizens that require long-term care in nursing homes, and individuals with disabilities. This is not a vision of America that I see, and it is not one that I can possibly support. We need to find a bipartisan path forward. We need to invest in prevention, increase efficiencies, embrace technologies like telemedicine, and capture the full potential of promising medical research like precision medicine to yield better care and at lower cost. We need to make it easier for small business owners who want to do right by their employees to provide them with coverage. We can strengthen our healthcare system without cutting the quality of care by investing in common sense changes to save money. For example, Medicare spends $1 out of every $3 on diabetes treatment. And while the total economic cost of diabetes is estimated to be at $245 billion per year, I have introduced bipartisan legislation that allows Medicare to enroll individuals at risk for developing diabetes into medical nutrition therapy services provided and proven to decrease the likelihood that they will develop diabetes. I have also introduced bipartisan legislation that expands Medicare's use of telemedicine, increasing access for patients in rural and underserved communities, and bringing down future health care costs by ensuring patients get the preventative care that they need to stay healthy. Instead of focusing on these critical challenges or sensible solutions, Representative Price wants to move us backwards and push policies that could leave 30 million Americans without health insurance. We can't look at this as simple budgetary math. We're talking about 30 million of our friends, family members, and neighbors, including over 800,000 Michiganders. Michiganders who could once again face bankruptcy and loss of their economic security just because they get sick. We live in a nation where historically the #1 cause of personal bankruptcy has been medical debt. That is simply unacceptable in this great country of ours. Whether we are policymakers or physicians, we should adhere to the central tenet of the Hippocratic Oath: do no harm. Our nation's seniors, children, and all hardworking Americans deserve a Secretary of Health and Human Services that will, at the very least, do no harm. Representative Price is not that person. It is for this reason that I have decided that I will vote against his nomination for the Secretary of Health and Human Services, and I urge all of my colleagues to do the same.